right, so again, this is the last na for this morning. This is your serous fluid analysis, no? So this is the last of the mga major yun na other body fluids. All right, katong sputum, bal, mga gastric fluid, duodenal, medyo mga minor na lang to siya. But then siya, of course, this is the last, your serous fluid analysis. So why are you so serious? Charot, check that. So of course, the serous fluid has siya makitaan sa itong mga cavities, all right? Especially cavities that line your lungs, the heart, and even the abdomen. So you have the pleura, the pericardium, and of course, you have the peritoneum. All right. Now take note that the cavities, you have an outer membrane known as the parietal membrane, and then you have the inner membrane, which really is kanang kung asa na nagtapot or nagtapot na siya sa organ, known as the visceral membrane. And the space between the two, you have parietal and visceral. This is where the serous fluid happens, or asa makitaan. So the purpose is, of course, for lubrication, okay? Para at least, especially mag-move ang lungs, diba? Mag-breathe na. So para dili sila less friction lang. So of course, natay lubricant. And that is the fluid, no? Serous fluid. Depende kung asa na cavity, all right? Now, of course, for serous fluid, it's the fluid between, as I mentioned, the parietal and visceral membranes. Again, function, as I mentioned, is to provide lubrication so that the two membranes, ilang surface, kay dili rub against each other or to create friction. All right. So here's an example, visual representation sa balloon. Ayan, if mo i-punch ang balloon, this is the organ, imo ang hand, and then kaning outer yun, pinaka-outer, that is the parietal membrane. And then kaning inner, kaning blue yun na nagtapot sa imong kamot, that's the visceral membrane. And then the space in between, that's the cavity which contains the serous fluid. All right. So I hope na gets lang ang ato analogy. All right. Now, your serous fluid, all right, accumulation, abnormal accumulation of this serous fluid is, of course, known as your effusion, all right? So, there could be, because of different mechanisms as to why nga mo accumulate siya sa tuang cavities. And that is known as an effusion, all right? And it can be classified into two major types. You have transudate and exudate. Now, for transudate, take note, there's a disruption mostly in fluid production and regulation between membranes. So, may problema sa pressure. Okay, so ito na siya i-discuss later. So there's a problem with the pressure. So kung sa mga diseases, usually mga systemic disorders, no? Such as hypoproteinemia, all right? Congestive heart failure, and nephrotic syndrome. There's a problem in regulation of fluid, regulation of the solutes. So na-affected ang pressure, what happens is leak ang fluid gikan sa capillaries padulong sa imuhang cavity. And it causes an effusion, and that is known as a transudate. Whereas an exudate, ang problema is naguba mismo, no? There's a membrane defect, na damage imuhang membranes imong capillaries, all right? Therefore, the fluid nilik padulong sa imong cavity, and nag-build up sila sa cavity. Therefore, they created an effusion, all right? So sa mga examples, and of course, mga infection, inflammation, and malignancy, because they increase the permeability, all right, of the membrane, especially the capillaries nimo. So therefore, nang leak ang mga fluids gikan sa capillary padulong sa cavity, and that's an exudate. So what you need to remember lang here is transudate is it's not related on infection or dili siya caused by infection. It's more on disruption in fluid and solutes and the pressure. Ang exudate, it's caused talaga by your mga diseases, okay? And usually ang transudate does not necessarily need a more rigorous chemical tests, because again, it's an effect, no? It's a complication of an existing disorder that was already diagnosed, okay, such as nephrotic, congestive heart failure, and then because of, again, alterations in the pressure, in the fluid, in the solutes, and all that, that's why nigawa siya sa imuhang cavity, and nag-build up siya as an effusion, all right? Okay, so we have here, again, the picture of a normal pressure, again. So your capillaries and your tissue, they exert pressures against each other, all right? So your capillary, as you can see, nasa you have the capillary filtration pressure, also known as your hydrostatic pressure sa capillary. And ang tissue po nasa hydrostatic pressure, pabalik sa capillary. And then imuhang capillary mismo nasa oncotic pressure, padulong agikan sa imuhang tissue. And then you have also the interstitial fluid pressure, as in ang daming pressure, all right? So ato lang na siyang summarize in a way later. Ayan. So this is the normal. Ayan. As you can see, again, there is fluid movement, of course, from capillaries to your interstitial space. Because remember that fluid is, of course, can pass through semi-permeable membrane. Diba? That's the point of osmosis. All right. Now, so this is the normal, dears. Ayan. As you can see, you have the hydrostatic pressure. So what is hydrostatic pressure? your blood itself, diba, contains a lot of solutes, alright? And of course, pag-agi niya sa imuhang capillaries or blood vessels, it will exert pressure. Kay kusugo na siya. That's blood flow. So that's known as the hydrostatic pressure. So it's the pressure that's pushing outside, alright? Now, of course, these plasma proteins, especially proteins, no, they are very osmotically active, okay? So they draw water towards themselves. And pag draw nila water towards themselves, again, that causes pressure gyapon, and that is known as the colloid osmotic pressure or oncotic pressure. And that is equal na siya in movement, okay? So if na mga disruption in the pressure, of course, dito na mo create leakage and effusion. So example for transudate, as you can see, there's a decrease in osmotic pressure, okay, or oncotic pressure because walay protein, okay? So therefore, wala may protein kaayo, so walay liquid, okay? Or walay substance na pull sa water padulong balik sa capillaries. Kaya wala may proteins, okay? And that's the purpose of the proteins. Sila mo attract sa water gikan sa imong interstitial space pabalik sa capillaries. And if walay proteins, of course, walay mo attract padulong sa capillaries sa sulod. So therefore, magsigira ka pagawas o fluid. And that contributes to the formation of effusion, and that is transudate. Okay? So, sige lang pagawas of fluid because again, gamay na lang ka-proteins, di ba? Hypoproteinemia, nephrotic syndrome, di ba? Because again, wala na yung proteins na mo attract sa water from the interstitial space, alright? Para sa oncotic pressure. So there's the decrease in oncotic pressure. So therefore, magsige na pagawas of water sa imuha or fluids, gikan sa imong capillaries padulong sa imong interstitial space. And it will build up to become an effusion. And that is a transudate. Whereas for exudate, as you can see, ang problema here is the membrane. No, na-damage ang membrane na yan. There is vasodilation, or not really damage, pero na vasodilation, increased permeability because of inflammation or infection. So what happens? Mang-leak, manggawas ang proteins, no? Manggawas ang fluid, so therefore, increase ang imuhang fluid sa cavity. That's why it's an effusion, and that is exudate. So therefore, exudate, iyang composition, it's mas daghang na mga cells, taas yung concentrations of protein, glucose bar, whatever, because again, it's more on capillary permeability. Okay, so ang imuhang capillary kay mas ni open, ni vasodilate, nang gawas ng mga proteins, mga solutes, no, mga cells, nabutang siya dili sa imong effusion. And that's why your exudate is much more parang severe and much more parang not really important, pero significant compared to the transudate in terms of analysis yun, okay? Because again, the presence of exudate indicates that there could be infection and inflammation. Alright? So I hope na-gets lang to ha sa ato ang mga, in a nutshell, no? Para mas, ano lang ta, okay? Para dili kay TMI. Alright? Sige. So, this is the summary. Ayan, ako Jumi. Alam niyo na. Okay, pasensya. Okay, wala na kayo tayong gabi. Like, nag-cramming na ako. Like, oh my God, no man ako ani. But anyway, and so, appearance, as you can see, transudate is clear and exudate is cloudy. Diba? Remember that transudate lang is just lost good of water, mostly fluid from your capillary padulong sa interstitial space. Ngano ganito? Kaya wala na proteins. Gamay na kayong proteins sa sulod sa capillary. And we mentioned that the proteins will attract the water from the interstitial space or fluid from the interstitial space pabalik sa capillary. Now, in the case of transudate or mga diseases na wala na proteins, of course, tanang fluid nimo manggawa sa imuhang cavity, which builds up as an effusion, and that is your transudate. That's why it's clear. Pero for exudate, as you can see, it's cloudy. All right, take note. Because again, remember that daghang mga cells, di ba, increase imuhang permeability sa imong capillaries. Okay, so therefore, cells, mga protein, solutes, whatever, manggawa. So that's why it's cloudy. Now, for the serum LD and protein ratio, which is the more reliable or mga most reliable methods here to differentiate a transudate and exudate, as you can see, the fluid ratio sa transudate and LD is gamay. Because remember that wala na kay proteins, di ba, sa transudate. Sa mga capillaries, wala na kay wala na kay mga enzymes. And of course, the proteins, DI and LDH, of course, example, dili pa sila mugawas sa imuhang interstitial space in cases of transudate. Di ba? Mugawas ra kay katulad fluid. Because again, nanggawas na, increase imuhang hydrostatic pressure. Whereas for exudate, as you can see, open ra imuhang membranes or capillary membranes. So therefore, vasodilation, manggawas ang protein, manggawas ang LDH. So therefore, mas taas ang imuhang ratio. Alright? WBC counts, so the same reason. Spontaneous clotting, possible sa exudate because, again, of vasodilation, pwedeng iyahang ipagawas ko ng fibrinogen sa imuhang cavity. Okay, sa imuhang fluid, serous fluid. Now, pleural fluid cholesterol is less than 45 to 60. Greater Japanese exudate. And as you can see, dears, for the normal, for the results good years, silang tanan sa exudate increased, except lang sa serum ascites albumin gradient. Decreased sa exudate, pero mas taas sa imuhang transudate. So that's what you need to remember lang. Basta decreased gani tanan, that's transudate, except for saag. Siya ang nasaag. Okay? So siya ang nasaag, si serum ascites albumin gradient. Siya ang nasalaag, nasaag. Okay? Si saag. Kay siya, increased sa transudate, decreased sa exudate. The rest, kay increased sa exudate, decreased sa transudate. Alright? So I hope na-gets lang to siya. Ang difference sa transhu and sa exu. Okay? Alright? Ayan, sige. Sana all, may pang transudate o exudate na ay kadate. Oh my gosh, sana all. Yes. Okay, di pa rin. Anyway, you have the Ribalta's test, also known as a Serous mucin clot test. So this is another way or test to differentiate your transudate and exudate. So what do you do? Acetic acid plus water plus the unknown fluid. If there is precipitation, then there is the presence of that is positive for exudate. Nga naman, acetic acid, all right, unknown fluid, if it contains a lot of proteins, diba, pwede siyang precipitate. And remember that exudate contains a lot of proteins because again, nanggawas na from the capillary kay vasodilation, all right? So heavy precipitation, Ribalta's test, or Serous mucin clot test. Take note here, very common question po. Next, you have the saag, again, which is ang different lang yun na result, no? So it's recommended to detect transudates of hepatic origin. So example, saag, serum albumin minus peritoneal fluid albumin. So if it's greater than equal to 1.1, that's transudate, okay? And if it's less than 1.1, that's an exudate, okay? All right. So therefore, okay. So therefore, as you can see, diba, kung less than 1.1, meaning sa imong equation, dapat mas dako ni siyang value compared to ani, okay? So therefore, mas daghang proteins na sa peritoneal fluid kaysa sa serum. Whereas for transudate, greater than equal to 1.1, mas gamay ang protein na nasa imong peritoneal fluid because that's a transudate, alright? So therefore, although decreased imong number of protein because of the transudate, diba, like nephrotic syndrome or what, most of them kinara sa sulod sa capillary. So ma-detect siya sa serum, alright? And gamay ra sa imong fluid na mugawas. Because again, diba, remember sa transudate, it's more on fluid loss yun ikan sa capillary. Okay, kaya imong capillary sa sulod, gamay na lang ang proteins, alright? And diba, the proteins will attract water or fluid from the outside padulong sa capillary sa sulod, alright? So wala na yung proteins, wala na yung attract ato. So tanang fluids nimo, diba, equal na hydrostatic and osmotic pressure, mas daghang hydrostatic pressure noon. So mas daghang fluid na mugawas padulong sa cavity. Okay? All right. Now we go now to your method of collection. You have the 3 P's, hindi siya 4 P's, charot. Ayan, so 3 P's, pleural, pericardial, and peritoneal or peritoneal. Normal appearance is of course clear, pale, yellow. That's why it's also known as serous fluid because iyang appearance kay murag serum. And iyang concentrations code actually is quite similar to serum because it's an ultrafiltrate code of plasma in mga serous fluid. Alright? So that's why it's called serous because again, medyo same siya appearance in mga serum, clear, pale, yellow. So for pleural fluid, thoracentesis, diba, thorax is diri sa imuhang chest. Alright? And then pericardial, you have pericardiocentesis, and of course, for peritoneal or ascitic fluid, another term for peritoneal is ascitic or ascites, is paracentesis. Okay, so here's an example of your thoracentesis. Normal volume, that's from graphs. Pleural fluid is less than 30 ml. Pericardial is less than 50, and for peritoneal, it's less than 100. But during effusions, dears, pwede siyang moabot up to mga pila ka ml. Daghan yun kaayo, pwede ma-collect. Alright? So, di ka ma-problema. Okay? Di pareha sa ubang mga body fluids na medyo gagmay lang yun. Alright? Ayan. Now, for specimen distribution, of course, i-distribute ka mo siya to the following tubes. For EDTA, it's for cell count and differential. Sterile heparin tubes is for micro and cytology. And for plain or heparin tubes is for chemistry. And again, for pH testing, dapat na siya sa ice para, of course, ma-prevent ang degradation and of the cells, alright? So para dili ma-affected ang pH na results, alright? Okay. Alright, okay. So, okay, alright, sige, ayan. Sige, that's for your collection, alright? So we'll start first with your pleural fluids. So for the other years, sa mga remaining serous fluids, Tabular ang gitatanan. Nasa inyong notes, di ba? Tabular ako para at least summary na din siya. Easy na lang. Okay? So for pleural fluid, 3 tubes yapon. You have the first tube is for culture and gram stain. So giuna nila ang culture and gram stain. And the others for cell counts and the other tests. Alright? Now take note what is the color. Ayan, clear pale yellow is normal. Turbid microbial infection. Bloody, ayan, you have hemothorax, meaning na ay something wrong or na ay bleeding due to sa cavity, or hemorrhagic effusion. Okay, could be na ay chronic infection or chronic disease that led to the infusion and then eye bleeding. All right. So pulmonary embolus, PB, and malignancy. Milky is chylous material from thoracic duct leakage. So na puncture ang lymphatic system. So na introduce ang lymph, that's why it's milky. Brown is rupture of amoebic liver abscess. Black is for aspergillosis or aspergillus, and viscous malignant mesothelioma. All right, so there's a cancer, mesothelioma. So we have to differentiate, of course, your chylous and pseudochylous. When we say chylous, of course, yung appearance kay milky. Now, kaning milky mga good ears, it can be caused by two or different causes, no? It could be chylous or pseudochylous. Ang chylous is it's caused by thoracic duct leakage or trauma na nabuka or na-damage yung lymphatic vessel, na-introduce ang lymph fluid sa imuhang pleural fluid or sa imuhang serous fluid. Whereas for pseudochylous effusion, it's more on chronic inflammation or lymphatic obstruction. So it's not more on leakage. All right. So again, chylous, no, na-adjoy lymph na ligawas or leakage. Whereas for pseudochylous, it's more on chronic inflammation. So sa ito ang lantawon, we look at the triglycerides. So take note, ang triglycerides yun na content atong lantawon. All right. As you can see, ang chylous, higher ilhang triglycerides compared to your pseudochylous. Remember that your lymph, diba, contains a lot of fats food, no? It has mga lipids, so therefore mas daghan ang imuhang chylous because your chylous effusion really contains lymph fluid na gikan sa imuhang thoracic duct leakage. Whereas for pseudochylous, mas daghan ang cholesterol compared to your chylous effusion because of chronic inflammation. All right, so possibly na-degenerate na ang mga cholesterol, nakitan sa fluid, so therefore mas daghan siya sa pseudochylous. But again, asa nato siya lantawon, dears, lantawon nato sa triglycerides. Okay? Triglyceride content pa lang, makabulo na ta kung kinsa ang pseudochylous or chylous. Basta taas og triglycerides, chylous. Kung gamay og triglycerides, you have pseudochylous. And therefore, for staining, of course, Sudan 3, remember triglycerides can be stained by Sudan 3, so therefore it can be stained by Sudan 3 chylous, and for pseudochylous, it cannot be stained. Okay? Remember that. So take note. So triglycerides palang daan, carry that. Okay? So that's what we look for, no? Or for differentiation of your chylous and pseudochylous effusion. Alright? So pseudochylous. Chylous. Nakita ko joke, pero wala ko joke naman. Okay, wait lang. Ako i-check. Kasi nakalimutan natin. Okay. Alright. Sige, so that's for chylous and pseudochylous. Alright. Now, of course, we also have to differentiate your hemothorax from hemorrhagic effusion. Okay? Now, of course, as you can see, for distribution of blood, ang hemothorax in a way, kay mo siya traumatic tap. And then, ang hemorrhagic effusion is the intracranial hemorrhage. So, hemorrhagic effusion is more on chronic na nahitabo. Alright? And ang hemothorax is possibly na bago lang siya na hitabo. Example, na pierce diri, no? Na aksidente magani ka. So, fresh pa ang blood. Alright? So how do we differentiate? We can check for hematocrit. If the hematocrit of the pleural fluid is greater than or equal to 1/2 of the whole blood hematocrit, then that is considered to be hemothorax. So example, if ang imuhang whole blood kay 50%, okay, and then imuhang pleural fluid kay 35% ang hematocrit, so half of 50% sa whole blood is 25. So therefore, mas taas ang hematocrit sa imuhang pleural fluid. Okay, remember, 1/2 of the hematocrit of the whole blood, if it's greater than 1/2, greater than equal to the 1/2 of the whole blood hematocrit, then that is considered to be hemothorax. So in this case, let's say 50% ang imong hematocrit sa whole blood, niya 35% sa pleural. So imong i-half ang 50, that's 25. And 35 is greater than 25. So therefore, kanina result is indicative of hemothorax. Nga naman mas taas ang imuhang pleural fluid. Remember that ang pleural fluid, ang hemothorax, there's really bleeding happening, no? So you're constantly producing RBCs or nag-introduce ka blood RBCs sa imong pleural fluid. So therefore, mas expected yun na mas taas ang hematocrit sa imong hemothorax, alright? Because Kasi hatag, kasi pour, no, of blood padulong sa imong fluid. Because again, there is a damage, there's a rupture ba of the blood vessel within the pita, which produces the bloody appearance or produces hemothorax. Whereas for hemorrhagic effusion, as you can see, less than one half. Ayan. So let's say 15% lang ang pleural fluid and then 50% siya po ng whole blood. So 25 and a half ani, di ba? So 15% is less than 25, which is the half of 50. Okay. So that is an hemorrhagic effusion. Nga naman, because that is a chronic infection na nahitabo. So it's been happening over pila ka months na or pila ka days. Ang nahitabo na is this is a combination of pleural fluid and the blood. So in a way, we're na-dilute na ang blood because it has been happening na for a long period of time. So therefore, mas gamay na lang ang macrophage, okay, compared to your whole blood. All right. So it's again, the dilute ang blood kaya it already contains a lot of pleural fluid na equalize na siya ba. Okay. So that's why mas gamay na siya hematocrit compared to your whole blood. All right. So that's for pleural fluid, the differentiation between hemothorax and hemorrhagic effusion. Now, for the cells seen in pleural fluid, as you can see, for neutrophils, if increase in neutrophils, there may be pancreatitis or pulmonary infarction. For lymphocytes, of course, TB, viral infection, autoimmune disorders, malignancies. Mesothelial are normal cells that line the serous membranes, all right, or they may be reactive. Decreased mesothelial cells associated with tuberculosis. Take note here. Kaya natabunan ang pleural membrane o mga deposits sa tuberculosis or sa disease. That's why dili makita na mesothelial cells sa pleural fluid. So increased number of mesothelial cells sa pleural fluid is really not that significant because again, it's normal, all right? Pero kung mo-decrease na gani siya, all right, then that's indicative of tuberculosis, all right? Yeah. Plasma cells, of course, TB, yapon, and malignant cells, mga carcinoma of the lungs, no? Adenocarcinoma, small cell carcinoma, and also metastatic carcinoma from other organs. Possible na abot na siya dito, okay? All right, that's for the different cells in your pleural fluid, all right? Now, for differential count peers, usually the total cell counts is not usually performed, kaayo, especially including mga RBCs and WBC. Actually, ang WBC count kaya gina-perform. Pero ang mas important is the differential count, okay? Because again, we can look at the different abnormal cells na adito para ma-differentiate nato ang cause sa imong effusion. Okay, all right. So that's for the differential count. For pleural fluid, here's macrophages yun ang kinadaghan, followed by your lymphocytes and then neutrophils. So normal yun ang kinadaghanan sa imuhang pleural fluid is macrophage. Okay, macrophage followed by the lymphocytes and then lastly you have neutrophils. Increased eosinophils may be associated with presence of air or blood. So increase ng eosinophils sa pleural fluid kung na ay pneumothorax or hemothorax, or aside from that, of course, if may parasitic infections or allergic reactions. Okay, all right. Sige. Ayan. So that's for the different cells of your pleural fluid. Okay. And then, of course, we can also test for tumor markers. Ayan. Tumor markers ayan, of effusions of malignant origin. Of course, CEA is for colon cancer. CA125 is ovarian and metastatic uterine cancer. CA153 and CA549 is breast cancer. And very important, here's your cytokeratin fragment, CIFRA211, lung cancer and breast cancer. And pwede siyang urinary bladder cancer. Yes, CIFRA211. So I think na-mention ba ni Sir Coloyan dito niya pag-remember? Ang CA125, 5, di ba, marag buros na mama. So ovarian, metastatic uterine cancer. And then ang 15-3, di ba, if mo siyang lantawon sa side, or if mo siyang lantawon ang 3 from above, mo siyang boobs. O, di ba? So that's breast cancer. O, di ba? That's one of the ways to remember your tumor markers. Okay? So kung basta gani CA125, ang 5 kay murag buros, di ba? Ayan. So it's for ovarian or metastatic uterine cancer. And then 15-3, if ang number 3 mo siyang lantawon from above, mo siyang boobs. Okay? Mo siyang boobies. Okay? So therefore, that indicates breast cancer. Tumor markers. Okay? All right. Take note there sa CIFRA211, bladder, urinary bladder, pwedeng lung and breast cancer. Okay. All right. Again, for clinical testing or chemical testing, of course, glucose is still usually pinaka-common. Decrease in rheumatoid inflammation and, of course, in purulent infection, mga bacterial. Lactate, of course, elevated in bacterial, triglyceride, chylous effusions. pH, decrease in pneumonia, all right? Or pH less than 6 years, it indicates esophageal rupture. Kaya na-introduce ang gastric fluid or acidity sa inyong pleural fluid. All right? So pH less than 6 indicates esophageal rupture. ADA or adenosine deaminase, sorry, greater than 40 U per L, wala na copyright. Greater than 40 U per L is indicative of, sorry, greater than 40 uh, 40 U per L is indicative of tuberculosis. ADA, no, adenosine deaminase. Ayan. And amylase, of course, indicative of pancreatitis, remember, and of course, esophageal, no, coming from the salivary gland, na positive, na amylase, and of course, malignancy. Okay, all right, ayan. That's for the different chemical tests for your pleural fluid. Okay, ayan. Okay, so that's for the different chemical tests. Take note, 88 greater than 40 per UL, greater than 40 U slash L, ayan, is indicative of tuberculosis and also malignancy, all right? Amylase, elevated pancreatitis, of course, and esophageal rupture because of salivary gland na amylase na butang sa, of course, pagkaon, maabot siya sa esophagus, all right? Next, of course, for pericardial. For pericardial fluid, we have 3 tubes gapon, EDTA for gross and microscopic exam, sterile plain or heparinized tube for microbiome studies, and heparinized tube for chemical analyses. Usually, ang pericardiosynthesis beers, it's not usually performed routinely or rare lang because it's dangerous, no? Kaya medyo thin lang ang membrane, no, sa pericardium. So, pwede yung ma-puncture accidentally ang heart, and that can lead to death or mga tamponad, mag-build up ang blood. So, very scary. So that's why it's not routinely or di kaya rarely performed na ang pericardiosynthesis. Alright, so for appearance, ayan, clear, pale yellow, normal, that's a transudate. Blood streaked, infection, malignancy, grossly bloody cardiac puncture, as I mentioned, or anticoagulant medications, and milky chylous, pseudochylous material. For additional testing, of course, increased neutrophils, bacterial endocarditis, malignant cells, metastatic carcinoma, CEA, metastatic carcinoma, gram stain, acid fast, of course, for different bacterial causes, and adenosine deaminase, tuberculosis. Basta ADA gani, that's for tuberculosis. All right. Now, usually, ang pericardial, no, if mag-effusion sa pericardium, it's mostly because of damage sa membrane. So mostly, ang mga pericardial effusion is exudate in origin or in type. Okay, pero na po yung mga transudates gamay, pero majority yung kay exudates. Okay, the buildup of fluid sa heart, it's most likely through damage sa membrane. Okay, so therefore, that's exudate. Okay, ayan, so that's for pericardial fluid. Very short lang years, okay, for pericardial. Because again, rarely performed, because again, medyo dangerous siya na procedure. Okay, ayan, alright. Yeah, of course, very important lang na characteristic, if taas ang WBCs, it could indicate bacterial endocarditis. So, sa may makita ng mga bacteria, of course, the common causes of endocarditis. You have the strep species, di ba? You also have the HASEC, pwede viruses, Coxsackie, and all that. All right? So, that's for pericardial fluid. All right? Now, an important part sa pericardial fluid is cytologic examination. No? So, differential count gyapon, and then you look for malignant cells because that could indicate metastatic carcinoma. All right? So, key. So, usually coming from the lung or breast na carcinoma. If makita nyo sa pericardial fluid, no, malignant cells, pericardial fluid, then it usually comes from the breast or lung na carcinoma. All right? Ayan. And for the last fluid years, you have the peritoneal or peritoneal. All right? Its iyang term is actually ascites, if na effusion. All right? Or acidic fluid. Ayan, that's the other name for peritoneal fluid. For 3 collection tubes, you have EDTA gyapon for cell counts, gross observations, and Wright's stain smear. Sterile heparinized tube is for microbiome, and for heparinized tube is chemistry. Okay? So for differential counts, here, again, take note, ang best method gyapon is cytocentrifugation. Alright? Pero again, if wala, pwede ang routine centrifugation. So again, that's for your peritoneal fluid. And for summary, ayan, as you can see, very concise lang yun. So for clear pale yellow, normal. For turbid, of course, bacterial infection or pwedeng increase in WBCs. Green, there is the appearance of bile, mga gallbladder or pancreatic disorder. So possible na ay regurgitation or na obstruction, no? May gawa siya dito. Blood streak trauma, all right, infection or malignancy. Milky, of course, lymphatic trauma and blockage. Peritoneal lavage, dear, take note, very important. Greater than 100,000 RBCs per UL is indicative of blunt trauma, meaning could be na higo siya or na puncture, no, like mga accidents, ayan. blunt trauma or injury, greater than 100,000 RBCs per UL. Ayan. WBC count less than 500 ang normal. Greater than 500 is of course bacterial peritonitis. Differential is for malignancy, all right? And for markers na to, CA, of course, usually colorectal or pwedeng GI cancer. CA125, ovarian, yes, ayan, natin lang discuss. Glucose, of course, decreased in tubercular peritonitis or malignancy. Amylase, pancreatitis, yapon, gastrointestinal perforation. ALT, also GI perforation, okay? Because again, these are enzymes that are found within the intestines talaga. So if mugawa siya, sa mga fluid could be na perforation, okay? Ayan. BUN crea, punctured bladder, ayan, because again, your peritoneal is abdomen. So of course, the punctured bladder, pwedeng ma-express ang urine dito, so therefore, ma-positive siya sa BUN crea. And of course, gram-stain acid fast, that's for culture, no, bacteria and TB. And ADA, as mentioned, basta ganing ADA, that's for tuberculosis, all right? Now, very important cells or very characteristic cells here sa peritoneal is the Samoma bodies. These Samoma bodies are concentric striations, ayan, para sa ano, Marcia parasite actually, no? Or Marcia wood, ayan, concentric striations of collagen-like material. They can be benign, but it is also seen in conditions such as thyroid and ovarian carcinomas. It can be found in a lot of areas in the body, all right? But for peritoneal fluid, it may indicate thyroid or ovarian carcinoma, all right? Samoma bodies, ayan, Samoma bodies na mga concentric striations, all right? And again, summary, what are the most common causes now that can affect or can be seen in effusions? This is from graph. I think sa'yo initially, Mycoplasma tuberculosis. That's MPV for plural and Staph aureus. For pericardial, Haemophilus influenzae and M tuberculosis. And for peritoneal, you have E. coli and pneumococci. So that's from graphs. And then this is from Brunzel. Summary lang again, what are the different types of effusion? As you can see, ang pericardial, it's not usually, pwede siya, i-mention sa imuhang Brunzel na pwede siyang dili categorize. But majority is usually exudates, all right? And yeah, so that's for the different types and different conditions, all right? Next, you have also here the suggested fluid specimen requirements from Brunzel Gyapon, all right? Pinaka-ML sa mga containers na to, all right? Sa cell count, differential, EBTA, good. And for mga microbiological studies, of course, sterile container, all right? Or pwede po na wala, all right? Because again, generally, dili na silang mukla, okay? So, pwede na silang ibutang non-anticoagulated tubes. But again, it's best na siya anticoagulant, all right? To prevent lang po clotting, mga sudden clotting, all right? And some pictures now of the cells that may be found in serous fluids. So these are your mesothelial cells. As you can see, mura siya o plasma cell or siya lymphocyte. It's quite larger, and it could be multinucleated, ayan. So these are normal, again, lining the serous membranes. So ang increased values niya usually really significant, but may indicate malignancy. Pero ang important yun is the decrease in value or decreased numbers, because decreased numbers could indicate tuberculosis. You have your plasma cells, seen again in TB or in cases of mga malignancies, no? You have here again a signet ring macrophage, no? So this is an example of a macrophage in which nakakaon siya o na-push to the side iyahang nucleus, alright? So signet ring macrophage, commercial ring, ayan. And then you have the LE cell, ayan. So of course, in cases of SLE, alright, and mga autoimmune disorders, you have here lipophages in cases na mga fatty degeneration, no, of the cells. So mo ingest ang macrophages of fatty of mga lipids. And you have ovarian carcinoma, as you can see, usually mga clumps of cells na medyo dagpo, and then uneven nuclear irregularities, hindi siya uniform in appearance. So that's ovarian carcinoma. Next, you have adenocarcinoma, so examples of peritoneal fluid, and you have also metastatic breast carcinoma. So dagko na cells, no? Nuclear irregularities, dagko because sila usually appear in clumps, no? So again, this is best identified by, of course, the pathologists. Okay, kita na mga medtechs ato nang tunan, all right? And then lantaw na yung appearance. So in terms of identifying the cells yun and diagnosing, that's for the pathologist na job. So if pathologist mo in the future, then this is your job. All right? Okay. So for serous fluids, there's as an intern, if makadawat mo, very common yun na tests is of course for cell count, na microbiome, and of course histopath for cell block. Okay? Because usually a cell block is for this purpose, no? Para ma-detect ang mga malignant na mga cells. All right? So that's why I'm telling you, dears, no, be careful. uh, i-make sure sa unit na micro unahang micro, alright? And then after that, i-inform kang medtech dito na ma'am, ano siya cell count, ano siya cell block, talihog lang po transfer or balik sa section, whatever. Okay, because again, for cell block, kailangan siya ulang ng formalin, okay? And mabutan ng formalin, natin siya yung microbiopathy, alright? Kung saan na lang, wala na kayo makuha na bacteria. So be careful, dears. It's not unusual na makadawat mo body fluids sa imuhang rotation sa hospital, alright? Samot na sa CM. And make sure good na makakita ka kung sa yung request form as I've mentioned because these body fluids may mimic or may look like urine, okay? So base niya makaligtaan or ma-miss mo siya, hindi mo siya makita na serous fluid di ay, di-process mo siya as urine. Okay, so be careful. Alright, so that's what I've been emphasizing to you, especially next SEM, mag-hospital na mo. Alright, and that's the end, yes, of the different body fluids na important yun, the major body fluids. Alright, so before we end, do you have any questions? Any clarifications? Alright. Yes, okay, alright. So before we end, again, as I mentioned, do you have any questions, any clarifications? So for